No, you're paying for the CEOs of big pharma and big health insurance companies to get their seventh yacht. That's what you're paying for. That's what we're all paying for. And that's why all the other developed countries who have universal health care, they spend 2 times less per capita than we do. They spend less money than we do because they have universal health care. Our current system is so fragmented that we waste so much money in admin costs. Doctors' offices have to spend more money on billing people because it's complicated and no one can figure it out. And when you have everyone on the same plan, you eliminate all of those wasted costs. And you give the government more control to regulate prices and to not allow these big pharma CEOs to charge absurd amounts for medicines that don't actually cost that much to make. My younger brother's EpiPens are like $600 with insurance. And that doesn't even sound expensive anymore, even though it is, just because the price of other things like insulin has gotten so expensive. That doesn't even sound that bad anymore, which is horrible. That money is not going towards people who are lazy and don't work. That money is going towards the CEO of Mylan. And luckily, my dad is a highly paid attorney, so they can afford it, no problem. But that is not the income that most people have. Question that if I ever have kids, if they need medicine that's that expensive, I don't know if I would be able to afford it either. And I make more than the average salary for the area that I live in. The cost of prescription drugs has gotten so expensive that even people who are highly paid cannot afford this stuff anymore. I'm pretty sure that my parents' deductible is like $15,000 and I think their premium is like another $15,000. If you tell someone that in Europe, their mouth drops and they're completely speechless. That is an absurd amount to have to pay for healthcare. Do you know how many uninsured people could be insured for that same price that they're paying if we had universal health care? We could literally save money while simultaneously insuring people who are not insured. It's a win-win situation, and I don't understand how there are so many people at this point who are still opposed to it.